This short video is on the rehabilitation of hip arthritis. We will aim to keep this video as short as possible, but without compromising on vital information. If you're watching this for the second time, then we suggest you skip the short theory section and go straight to the rehabilitation exercises. The exercises are grouped into the stretching or mobilizing type and strengthening type. Glide your foot slowly away from you, straighten your leg down, and then again glide your foot up so that you're bending your hip all the way as far as possible. Put your heel as close to your buttocks as possible, and then slowly let it glide down all the way, and repeat it with the other leg. Next exercise is basically stretching the hip muscles, especially the glutes, the buttock muscles, by bringing up the hip slowly towards your chest. So bend the knee and you can assist it. If your knee is okay, hold the knee. If not, hold the back of the thigh. Bring it to a comfortable level, pause it there, feel the stretch at the back, and in a slow, controlled fashion, put it down onto the floor. Let it rest, and then repeat it again. If we don't do the full maneuver, we're not exercising the full range if you just keep it in a flexed position. Stretches the back muscles, the glutes, and some of the hamstrings. Now, what about now stretching the inner thigh muscles, the adductors, yeah? Put your feet together like that. So you're pressing your soles of your feet together and just dropping your legs outwards. Just let the weight of your legs stretch the inner thigh muscles, the adductors, yeah? And then maybe close them gently, and then again let them splay out like that. Now, if you want to give it a bit more assistance to get a bit more stretch, you can put your hands on your thighs and gently push them down, depending again on what stage you are in your rehab program. The next one, I want you to stretch the back of your leg by putting one leg forward, yeah, and keeping that completely straight. A bit further forward if you can. You're right there? Yeah. Yeah. So by bending the other knee, you are increasing the stresses at the back of this leg. Yeah, are you okay with that? Yeah. Obviously, you need to have the control and the balance to be able to do that. If you feel unstable, you can use one of your hands to hold onto a wall, onto a chair or something like that. The next one again involves stretching the hamstrings on one leg, but inadvertently you're actually strengthening the quadriceps on the other because one of the legs is actually supporting. So you're using the quadriceps, and then the back leg, which is straight, is being stretched. So you are stretching the quadriceps on these legs, and also maybe a bit of the psoas as well, and a bit of the calf muscles. And on this side, you're actually challenging the quadriceps, you are strengthening the quadriceps. So you are strengthening this, you are stretching that. Again, if you need support, you hold onto a surface. Try not to overextend your spine like that. That's it, keep it straight. Yeah. Yeah, the next one is a variation of what you've just done, very similar, but we want to stretch the whole torso, yeah, by you holding your hands up and pushing them backwards. So the same as before. And lounging forward, yeah. Again, if you can't extend to this amount of limit, you don't do that much extension because not everybody can have this kind of flexibility in their spine. Another stretching exercise for the quadriceps is again to do something similar to the previous one by putting one leg quite forward and the other one all the way back as much as you can manage. Yeah, again, if you can do this, some people won't be able to do this. And obviously you need to watch your knee in case that has been stressed unduly, or keep it a bit at 90 degrees maybe rather than overflex it. Yeah, that's it. Now we're going to go on to some powerful stretches of the adductors. One is the side lunges, one side at a time. So do you want to demonstrate that for me? Sure. Good, you can support yourself. You can go down as slow as you can manage. And you should be stretching, obviously, that leg, the hamstring as well as the adductors, the inside muscles. You are stretching lots of muscles. And you're also stretching, of course, a lot of hip structures, ligaments, and so forth. So do you want to demonstrate the other side as well? The next one is sitting down, and it's a classic stretch for the glutes and maybe a bit of piriformis and also the capsule and ligaments of the hip. So it's a cross-leg position, sitting down, pulling the knee to the opposite side. Yep, so you're pushing that leg in this direction. Yep. You're feeling the stress on that side, on the glutes on that side. Yeah. And then show us the other side. Yep. You can use your hand, you can use your elbow, depending how much flexibility you have in your spine as well. Do you want to demonstrate the other way as well? Yep. Obviously, if you can't do that, just use your hand to pull your leg. So the next one, it involves you lying down, crossing the leg in a similar manner and hugging it towards your chest. So crossover like that. Depends again on your flexibility of your knees and your hips. If you can manage that, you can do that, or you can pull that leg, maybe. It's easier. And don't strain your neck and your back. Keep your body straight down on the floor. And maybe you can start lower down, and as you get the flexibility, gradually pull it up towards your chest in stages. Yeah. Next one, it's a mobilizing but also a strengthening exercise. It involves you sticking your leg up into the air while you're lying flat and drawing circles with your foot, if you can manage it. Hold the leg up and imagine there's a circle on the ceiling and you're tracing that circle. So obviously you're using quite a few muscles there in lots of different directions, lots of stability. Yeah. And you can vary this exercise by pointing your toes towards the ceiling, so you're tensing those muscles there, and also pointing the toes towards your face as well when you're doing it. So that's it, and that's another variation. So you are getting the hamstrings and the calves to engage even more. It's quite a taxing exercise, isn't it? Yeah. It's a safe exercise because you are supported, but it helps you to strengthen the hip. Let's continue with stretching of the quadriceps. It's a very powerful, very tough muscle. So let's have you on the floor kneeling. If the exercise mat is not soft enough, that's going to irritate your patella, your kneecap. So I suggest you put something softer to pad the pressure on your kneecap, like that. And in a gradual fashion, Andre, go forward without extending your spine by resting yourself on that leg. So put the weight, most of the weight on this leg. Use the other one for support. Hold on to that for several seconds, relax it, and then repeat it again. So that's quite a powerful and effective stretch for the quadriceps. It also stretches your psoas, of course, and inner muscles of the pelvis there. The next one, what I want you to do is to lie on your side. Start with both knees bent so that your pelvis is stable. We're going to stretch the top leg, basically. Yeah. So with one hand, you're going to pull this leg backwards. Yeah, without putting too much extension in your lumbar spine. Try not to extend your pelvis. That's why we keep this bent. In fact, bring it even higher. By doing that, you are protecting the lumbar spine from too much extension, and gradually pull it backwards. Provided you have no problems with the knee, you can do this amount of flexion. Hold on to that, and then relax it, and then pull back again. Again, knees together all the way up. Grab one leg. Can you hold it from above the ankle so that you're not stressing your ankle? Good, and don't overextend, obviously, the lumbar spine. Yeah. And one of the most commonly seen stretches of the quadriceps is when you stand and bend your knee and pull it backwards. Again, you need some stability for that, and you need to make sure you're not overextending your spine. So you are bringing up the thigh backwards, keeping up the torso straight, gradually like that. And you can bend that leg if you want, so that it gives you a bit of stability. Yeah. and then relax, and then pull it back again. Yeah, not always effective, because if you have flexible knees and things like that, you're getting all the flexion taking place from there. You're getting, of course, some stretching of the front of the hip, the ligaments and lots of other structures, not just the quadriceps muscle. Next exercise, Andrea, is to do some rotations of the hip while you are sitting down, which involves suspending your leg and twisting it inwards and then outwards. So you are rotating the hip up here, basically. The knee is not actually being mobilized. We are mobilizing the hip in there. Yeah. If you want to obviously make it a bit more challenging, you can put a small weight down there, like a kilo, and do the same exercise, or even attach an elastic band and stress the band in both directions. Then the next one is squats or sitting down on the chair. If someone had a hip replacement, if they're very weak, one of the most important activities is actually sitting on the toilet, sitting on the chair, getting out of the toilet, getting out of the chair. So you're going to do lots of those attempts so that we can get the quadriceps and the glutes working. So stand up for me. And you're going to attempt to sit on the chair, but don't sit, and then stand up again. And up again, yeah. Do it slow motion for me. Exercises the quadriceps and the glutes and so forth. But maybe even in the earlier stages, you will sit down because you don't have the strength to maintain the erect posture. So you rest a bit and then you do it again. So that's a good way of training someone to use their muscles after a major intervention. The next one is extension of the hip whilst you're standing. So you can hold onto the chair for stability and basically extend the hip without extending your spine. Yep. There will be a bit of extension of the spine inevitably. Bring it a bit further forward. Yeah, and then backwards. Try and keep the knees straight when you extend. And we are contracting, obviously, the glutes and the hamstrings there to give you a bit more strength. Nice and simple, but someone who's in the early stages of their rehab program, maybe that's all they can achieve. You're going to use the knee now to perform some knee flexions. So we're strengthening, again, another part of the hamstrings. Yeah. Again, if you want to take it a step further, you put a small ankle weight, like a half a kilo and then a kilo, to give it a bit more of a challenge. Good. The next one is doing the abductors. So again, holding for support, I want you to splay your thigh outwards, pause, and then back to the neutral. So you're engaging the abductor muscles of the hip, yeah, primarily the tensor fascia lata and some of the upper glutes. The next one is high steps on the spot. So high steps up and then down. You can repeat them on one leg, yeah, as many times as you want. And again, if that's unstable for you, you're frail, you can do that for a bit more balance, yeah? Mm-hmm. Or you can hold yourself. Then when you're ready, you don't hold, so you progress your balance as well gradually. The next one is gentle squat, holding onto a chair. It's about 45 degrees. Yeah, that's good. You pause when you flex to 45 degrees. Yeah. Have a little bit more space between your feet, perhaps. The next one is what we call the goddess posture. It involves you having the feet quite wide apart, you open the arms for balance, and you squat with the legs open, basically. Slow motion, pause up to a position of stress, and then up again. So you're strengthening the quadriceps, you're strengthening your glutes, improving your balance, and general stability of the hips. This is one of the classic squats again, whereby you can take a slightly deeper squat now. You have advanced in your program. So use your hand in front of you to counter balance yourself because you want the weight at the front. That's a good range. And up again. Good. Pause it at the end. Okay, keep the band stressed and take steps to one side of the room as far as you will go. Keep the knees flexed to about 45 degrees or even less than that if you want. If it's very easy, put a tougher band. If it's too hard, obviously change it accordingly. Yeah. The next one involves a bit of balancing. Do a gentle squat on one leg whilst the other one is in front of you. Yeah, pause there. Again, this is slightly more advanced now in the program. You need to be able to have the balance and control and stability on one leg. Yeah, most people will not be able to do this for quite a while, but that's something maybe you could aim for. Slow motion, yeah. Keeping the band stressed. If it's too soft, we'll give you a harder one, but that's the principle basically. This exercise involves engaging your glutes and a bit of your hamstrings by raising the leg straight off the floor, just a few degrees, not very high. And you can see already that you're engaging both the hamstrings and the glutes. Pause it for me for a few seconds and then back down. And again. Good. Now, if we want to isolate more the glute or the buttock muscles, you bend the knee on this leg and you point your heel a little bit up like that, and then you raise the thigh off the floor, just a few inches, just tiny amount, but that's enough to contract your buttock muscle, your glutes. Yeah, that's quite an effective exercise. Yeah, and because you're lying flat down, your pelvis is supported, your spine is supported, so there's a degree of safety there. And you're going to raise the leg up towards the ceiling and pause there and then back down. Again, you're engaging the same muscles, but also obviously because you are on all fours, you are using your spine and your spinal muscles and your abdomen to strengthen those areas as well. Yeah. Don't overextend, hold it there, pause, and then bend the knee, bring it down. You can alternate legs if you want. So show us the other one as well. Knee straight, and then back down. Just a tiny amount there, and then back down. In some patients, that's all they can achieve, or even just the attempt, not even lifting. But that's the way to progress, basically, yeah? Just a tiny amount of movement. So we're getting a straight line, more or less, yeah? With the body. Don't overextend, stay there. A straight line, more or less. Don't overextend. So keep one leg down and raise your pelvis up. That's excellent. That's really putting the forces on that leg and the stability on this leg, nice and slowly. If you're struggling, don't do it, because I don't want you to drop your body down. I want you to lower it down in a nice and controlled fashion. Raise up the leg, pause it there, and then back down. In some patients, this is all they can achieve at the beginning. As they get stronger and stronger, then you can put an ankle weight. Yep. And also you can put an elastic band. Slow motion, hold it. Again, that's a good exercise for strengthening part of the glutes and the abductors of the hip. The next exercise, you're on your back again, and you're going to do the bridge, but with elastic band on your thighs, keeping that under tension whilst you're lifting up core stability and strengthening the pelvic region, basically. Lift up for me, keep the tension, good. And slowly back down. Maintain the tension on the band. Don't close your thighs, keep them outwards and back down. Stretch the band, lift up. Keep the stress on the band, and then slowly back down. And again. Great. This can be done without the elastic band at the beginning, or when you progress through your program, you can use the band there. So we can do the clamp, raise the knees outwards, pause there, and slow motion. Don't close them all the way. Keep the tension on the band. And then again, yeah, that's a good exercise. As a matter of principle, we want to add a few stretching exercises at the end of every program, but obviously select the stretching ones and move them around in sequence. Yeah. So don't do a lot of strengthening exercises without doing a bit of stretching at the end. Remember, we're dealing with quadriceps, glutes, hamstrings, and maybe the calf muscles in this instance. Thank you for your help.
Thank you.
Management of osteoarthritis of the hip. Losing weight, strengthening exercises, exercise modification, hydrotherapy, systemic anti-inflammatories, simple analgesics, home changes, office changes, bracing or other support devices, footwear with shock-absorbing soles, load management advice, and corticosteroid injections.